Low vitamin D has wide-ranging negative effects on the human body because vitamin D functions like a hormone and is essential for calcium absorption, immune regulation, muscle strength, brain health, cardiovascular protection, and hormonal balance. When vitamin D levels are low, calcium and phosphorus absorption from the intestines drops, leading to weak, thin, and brittle bones, increased risk of osteoporosis, osteopenia, frequent fractures, bone pain, back pain, and delayed healing. In children, it causes rickets with bone deformities, and in adults, it results in chronic skeletal weakness. Muscle tissue also depends on vitamin D, so deficiency commonly leads to muscle weakness, cramps, poor balance, frequent falls in older adults, reduced stamina, chronic fatigue, slow physical recovery, and overall low energy. Vitamin D plays a critical role in immune system regulation by activating immune cells and controlling inflammation. Low levels weaken immunity, causing frequent infections such as colds, flu, and respiratory illnesses, slower recovery from disease, and a higher risk of autoimmune disorders. The brain contains vitamin D receptors, and deficiency is strongly linked to depression, anxiety, mood swings, irritability, brain fog, poor concentration, memory problems, sleep disturbances, and an increased long-term risk of neurodegenerative disorders. Cardiovascular health is also affected, as low vitamin D is associated with high blood pressure, inflammation of blood vessels, increased risk of heart disease and stroke, and impaired circulation. From a metabolic and hormonal perspective, deficiency contributes to insulin resistance, type 2 diabetes, weight gain, difficulty losing fat, thyroid imbalance, COEs, fertility issues, and overall hormonal dysregulation. Chronic pain and systemic inflammation are common outcomes, with persistent joint pain, stiffness, body aches, and symptoms often mistaken for arthritis or fibromyalgia. Correcting low vitamin D requires a combination of lifestyle and nutritional strategies. Regular sunlight exposure is the most natural and effective method, ideally exposing face, arms, and legs to direct sunlight for about 20 to 30 minutes, 3 to 5 times per week, preferably between 10 a.m. and 2 p.m., without glass barriers and with minimal sunscreen during short exposure. Dietary sources should include fatty fish like salmon, sardines, and mackerel, egg yolks, fortified milk, curd, butter, cereals, and sun-exposed mushrooms, though food alone is often insufficient. Supplementation with vitamin D3 is commonly required, with maintenance doses usually around 1,000 to 2,000 IU daily, while higher doses should only be taken under medical supervision. Proper absorption requires taking vitamin D with healthy fats and ensuring adequate intake of calcium, magnesium, and zinc, as magnesium in particular is essential for vitamin D activation. Precautions are important because excessive supplementation can cause calcium toxicity, kidney strain, nausea, and abnormal heart rhythms. Therefore, blood testing of 25OH vitamin D levels is recommended before long-term or high-dose use. Obese individuals may require higher doses due to fat sequestration, while people with kidney or liver disease must be especially cautious. Consistency is key, as vitamin D correction is gradual but profoundly impactful. In summary, vitamin D deficiency is a silent yet serious condition that damages bones, muscles, immunity, mental health, heart function, metabolism, and hormonal balance, but early detection and correction through sensible sun exposure. Nutrient-rich diet and carefully monitored supplementation can restore energy, strengthen immunity, stabilize mood, prevent chronic disease, and significantly improve long-term health and quality of life.